If you're a doctor, you know this feeling. The last patient is gone, the clinic's finally quiet, but your day? It's nowhere near done. You've still got a mountain of documentation to climb. But what if you could tackle that mountain with a tool that felt as natural and essential as your own prescription pad? That's exactly what we're going to break down right now.
So let's just start with a really direct question. After all the patient care, the procedures, the actual hands-on medicine, where does the rest of your day really go? For so many of us, it just vanishes into this black hole of administrative work. It's time to shine a light in there.
Okay, let's dive in. In medicine, you can't treat a problem until you accurately diagnose it, right? So our first step is just a simple time audit. We're going to put some real hard numbers on that feeling of being completely swamped.
Just take a look at the sample audit. 15 minutes per soap note, multiply that across a whole day of patients, hours and hours on referral letters, and don't even get me started on prior authorizations. Here's the staggering part. It adds up to over 20 hours a week. This is that pajama time that just eats away at your life. So what's our goal? To slash this by 60 to 75%. Yes, really.
So now that we have the diagnosis, let's talk about the treatment plan. And this isn't about adding another complicated piece of technology to your life. No way. This is about reimagining your day and weaving AI into those little moments you already have, turning this burden into a huge advantage.
The change starts the second you walk in the door. So instead of that frantic morning scramble trying to piece together a complex patient history, imagine this. You arrive and there are AI-generated summaries of your most challenging cases just waiting for you. You walk into that first appointment feeling prepared and proactive, not overwhelmed and reactive.
And this right here is the absolute game changer. You know those 2 or 3 minutes you have between patients? They're no longer dead time. They become the most productive part of your day. Instead of letting notes pile up, you use that tiny gap to finish the documentation for the patient who just walked out. This one habit stops that end-of-day pileup before it can even begin.
So how is that even possible? Well, this is the engine that drives the whole thing. It's not some complex software, it's just a simple, quick-fire prompt, a very specific instruction. You feed it a few bullet points you've already scribbled down, and in seconds, the AI structures it all into a perfect soap note. It's truly that easy.
And the result? Well, the end of your day looks totally different. Instead of staring down that 2-hour mountain of charts and packing up work to take home, you're just done. Your notes are finished. You can actually leave when the clinic closes. And this isn't just about getting your evenings back. It's about getting your peace of mind back and ending your day with a sense of completion, not dread.
So how do we actually make this happen? How do you build this new workflow so it becomes a real sustainable habit? Well, it happens with a clear, totally manageable 30-day action plan that helps turn these techniques into second nature.
And the plan itself is beautifully simple. Week 1, just master one single task, like those soap notes. That's it. Week 2, you expand to referral letters. By week 3, you're fine-tuning and optimizing your prompts. And by week 4, it's not something you're trying anymore. It's just how you do your work. It's a slow, steady, manageable progression.
And let's be really clear here. This isn't just about feeling more efficient. The impact is real, it's tangible, and you can measure it from day one, literally watching those administrative hours just shrink down to minutes. Now, what's so incredible about this slide is it's the visual proof. This is what happens to all that pajama time. It starts at 8 hours a week at the beginning of the month, and then it just plummets to nearly 0 by the end. This is what taking back your evenings actually looks like on a chart.
Which brings us to this final really powerful number, 15, plus hours saved every single week. I mean, that's not just a small efficiency tweak. That is a fundamental transformation of your work, and frankly, of your life.
And that all leads to the most important question of all, really, because this was never just about saving time. It's about reclaiming your life. So when you get those 15 hours back every single week, what are you going to do with them?